Welcome everybody, and welcome Kristen to Humanities Values. We're going to be talking about psychology and depth psychology and your role as a therapist. So welcome. Good to
Thank
have you.
you. Thanks for having me.
Absolutely. So Kristen Hornung, if I'm pronouncing that correctly, thank you, is a licensed professional clinical psychologist offering in-person therapy in Encinitas and virtual therapy throughout the incredible state of California. Holds a PhD, definitely a little jealous, in depth psychology from Pacifica Graduate Institute, an MA in counseling from the University of San Diego, and a BA in chemistry, because why not? We'll get into that, why you made that switch later, from Brown University. And you are an EMDR certified therapist by EMDR, and you specialize in helping deep thinking, over-functioning individuals, this sounds familiar, with anxiety, trauma, and relationship problems. So again, thank you for coming in and having this chat. Looking forward to
Thank
this.
you for having me. I'm excited.
Yeah. Okay. So we'll nerd out here in a bit about everything that you've studied. And so beyond the kind of overarching, bio there, what's your background in mental health? How long you been at it?
So I graduated from my master's program in 2012, but during that master's program, so from like 2010 and on, I was working in mental health. And most of my experience at first was in community mental health.
Hmm.
So I've worked in like residential treatment, I've worked in outpatient community mental health clinics, I've done in-home work, I've also worked for nonprofits in schools with kids who have IEPs. So I've worn a lot of different hats.
Okay. And so for general audience, IEP is
Meaning individualized education plans. So these
right.
are, I was in junior high and high schools working with youth who basically had what we call like social emotional challenges that are impacting their ability to learn. So I did one-on-one and family therapy with those kids to help them basically manage their mental health so that they could learn better in the classroom.
Gotcha. So
Mhm.
something like, accommodations that may be specific to the student to help them with, getting along, perhaps at times with their own learning experience, but getting along with students, teachers, kind of helping out with outcomes.
Yeah, but it was amazing how broad the work
Hmm.
could be. So I worked with everyone from literally like these genius kids on the autism spectrum
Hmm.
to kids with ADHD to adopted youth who were having, some adjustment, identity kinds of challenges coming up for them, anxious kids, I mean, you
Yeah.
name it. Kids with severe medical problems
Hmm.
and medical trauma as well. So it was a great experience. I did that when I was an associate, and then I also did some more work in that area when I was licensed.
Okay. What kind of accommodations are generally, you don't have to get into all the specifics,
Mhm.
obviously, but I mean, what would be helpful for, pick a kid, that's like, here's what's going to be helpful to help you facilitate better, frankly, educational outcomes.
Right. Well, a lot of it was therapy, like
Hmm.
CBT or DBT, talk therapy for trauma, just helping them learn coping skills that they could
Sure.
then advocate for themselves in the classroom to use. So it could be something as simple as, a kid recognizing when they're getting anxious and then taking a break to use those coping skills or having like fidgets handy. Sometimes they'd work also with like an occupational therapist or physical therapist. So a kid would have a plan of things they could do when they were feeling overwhelmed, which is really cool because sometimes if you're helping someone with anxiety and they also have autism, for example, doing something like heavy work, like going outside and going up and down stairs while wearing like their backpack,
Hmm.
and then also like challenging the negative thoughts or like doing grounding skills. The combination can be way more helpful than just doing one thing independent of the other.
Right. So basically no silver bullets.
No.
Yeah. Okay. All right.
Everything very individualized and
Right.
comprehensive. Like
Yeah.
work with everybody,
Okay.
come at it from all angles. And I think that's probably the biggest theme in my clinical work has always been let's come at this from all angles. Like if someone
Hmm.
has diabetes, let's see how that's working with their mental health. If
Hmm.
someone has, like a eating challenge or something like that, that's also impacting their mental health. Let's see how can I support them and what team members can I bring in?
100%. Yes. you well, and it's depression, for instance. It's that lull, that low energy, difficulty sleeping, and so on. And you're going, what do you eat per day? Well, I eat chips and ho-hos and so on. Or like, that might account for at least contributing factors of feeling like garbage because you're
Yes.
literally, this is what you're eating. So obviously it's not a one-to-one thing here, but it's those as you put it, multivariables, or when I was working in community health, they had this idea that wraparound care, the notion of multiple professionals helping people out in multiple areas of their life.
It's huge. I mean, I can't
Yeah.
even tell you how many times when I was a clinical supervisor for a while in community mental health for both a child, youth, and family program and an adult program.
Mm.
And there were so many times when a mental health crisis involved a medical crisis.
Mm.
So it was things like, okay, you're having suicidal ideation, seeing your chart, you have diabetes, and they check their blood sugar and they're literally like, it's a life-threatening situation. They need to go to the hospital for both. But
Right.
sometimes the medical shows up as mental health, sometimes the mental health shows up, right? It's all so interwoven, and we just really have to have a big picture, I think, in order to be the most helpful to our clients.
Absolutely. Well, and diabetes is a good question, good one. It's like your sugar level being too low can contribute to one set of seeming cognitive issues, and then, or actual cognitive issues, depending how you want to look at it clinically, and then but too high can then be its own.
Yes.
It's like, I'm
Hmm.
feeling manic. Well, yeah, your sugar is at like 600. It's like, this is kind of a
Yes.
problem. It's a little wonder.
This is a medical emergency.
Yes.
Like, yes, yes, therapy will help you, but first we have to get you
Right.
medical care. And if you're having a hard time getting the medical care because you're anxious of going, like, let's see if we can meet you halfway. Let's support you in getting through the door. Because a lot of times people have fears of that, like getting their blood work done, and that's where we can be really, really instrumental, I think, in just helping someone even go and get that blood work done, go and talk to their doctor, helping them come up with like a list of their questions. I think a lot of times this is stuff that gets left out of therapy training, but it's so key.
I can attest to the fact it was left out of mine. So the entirety of physiology was a future study. It was not included at all in that. Yeah. Okay.
Yeah, and I think, yeah, it's cool. It's where case management can be really helpful for therapists.
Mhm.
I think getting that early experience as a case
Right.
manager was so helpful.
You're speaking my language.
Yeah.
I think my first experience was definitely more case management, community mental health, and then also in elder care, working with
Ooh.
medical professionals and the intersection of that medical issues with psychotherapy and case management. It's something I recommend almost everybody starting out to do. One, helps boundary setting because you really learn fast what you are and aren't willing to put up with when you have people throwing things at you, including bodily fluids.
You sure do. Yes, you learn how
Yeah.
to set those boundaries
Yep. Yep.
and
And
de-escalate.
and
De-escalation is
huge.
great.
Right. Yeah, this is not the quietude of an office. This is which is frankly the minority of serious mental health issues, or at least can give a false idea of what is out there. You have people struggling with depression and anxiety and so on, not wanting to diminish anybody's own experiences. At the same time, it's like there's depression and then there's hospitalization. That is that the small minority of the experience, and yet clinically speaking, that's what so much of the system really is concerned with, is kind of going, when we talk about this, we're not just talking about I'm sad. It means I'm really here willing to take my life, as one example.
Yes, I remember too thinking, okay, I have my CBT like Aaron Beck book, and okay, I have a new client with depression, not understanding the depth of dysthymia, like how potent like
Mm-hmm.
dysthymia can be, how challenging it can be to get traction
Right.
when the depression is just that settled and that persistent in someone's life, and being like, okay, how how far am I getting with these tools? I need more tools.
Right. Well, oh, more tools and more. I don't know about you, but I know there's recently in the last perhaps couple of years, personally, there's been this shift. After being involved in for so many years with so many people, and kind of going from that, yes, needing more tools, but also doubling and tripling, quadrupling down on the human relationship of what this person ultimately ends up really needing is just that space to, like, no, this does suck. I know suck is just a purely clinical term, but I mean, it really is like, this is terrible. This is not a character flaw. This is not some soul thing. This is a serious medical problem that your body brain has gone, no, I can't do this. And here you are stuck working in that almost betrayal. Sometimes some of the language that I often will hear.
Yeah, a lot of people have been told, get over it,
Mm-hmm.
move on, focus on the positive, find God, get some crystals, like try this over the counter herb. People just have tried so hard. Like, here's a band-aid, here's a band-aid, or, here's what worked for them maybe, but it's not working for this person because they have really severe persistent depression and it's just not helping them.
No, no. Well, and even what works. That's a deeper epistemic philosophical perspective to get into. But what worked for them may be their own declaration, but it worked only because they didn't know any better. There may have been something else going on that this was the cover for. In therapy, I know these days was it the phrase "purple hat therapy." It's the new thing when really it's just rehashed other stuff that
Yes.
worked, but now we want to be able to charge money to get training in it, but really it's just this other thing that's been happening for quite
Yes.
some time. Yeah.
Yes, there's a couple of new theories that they charge a lot of money to get trained in that are basically, yeah, purple hat.
Right. Pretty much. Yes. All right. We'll come back to that. Well, and you mentioned things around like what people try and what they're told is going to be helpful. So how would you describe your style of therapy? What are some of the theories? I know I mentioned some of your education, background. Yeah, kind of how do you approach things?
Yeah. So, one, I approach things being really authentic about who I am as a therapist. So, I'm actually pretty upfront with my clients. I'll provide brief self disclosure, like, I'll include like my cultural identity, a little bit of my own, just very briefly, recovery experience. I share broad, just because a lot of the people I work with have complex trauma histories. And what I don't share, they'll probably pick up on anyways. And a lot of times they want to know who I am. Some people don't, and that's fine. And I will literally disclose absolutely nothing to them. But if people ask me, I'm okay with sharing certain things about myself. And I just tell them, you can always ask me a question. If it's outside of my boundaries, I'll just tell you that. But you don't have to do the calculation in your head. I would rather you just tell me, because I think it starts with that kind of having a trusting, collaborative, therapeutic relationship. And I prioritize feedback. So it's like, I always tell people, okay, like, one, it's our like therapeutic alliance. It has to be strong. And so I want ongoing feedback. Every session, I ask for feedback at the end, unless for some reason I'm like really absorbed in the session and I forget. But I have a practice. It's built into my notes. I ask, what's the one thing you'll take away from today? And then I'm kind of type A in this regard. So when I first start meeting with someone, I always give them assessments and like screening tools. Have a little bit of a long intake questionnaire, but I tell people, you answer what you want to answer,
Right.
skip what you need to skip. And then I study it beforehand. I come up with like my follow-up questions. And then when we meet, we draft a goal to guide our work together. And then every 3 months, we revisit that goal. And so to me, that's like the fundamental piece of how I work is it's goal oriented, collaboration oriented, and then like attachment driven, because I tell them, like, if we can establish safety, you and me, in this room or this space that we're working in, and you can get comfortable giving me clear feedback and I can give you feedback, that is the skill that you can then generalize to other relationships in your life. And what is therapy for if not to like have good relationships?
Right. Yes.
Right?
I love that. Yeah, I mean, what is it for that? There was a conversation I got into a while back around the difference between like mental therapy and, for instance, coaching. Very broad term, of course, but and that one person tried to describe it as, well, coaching's about goals, and I was like, what are you doing in therapy if you don't have any goals? What besides helping you pay your bills?
Yeah.
What exactly is being accomplished here? And yeah, that conversation didn't go very well. But It's nice to hear the call it type A or not. Just having that kind of structure, I'd imagine, is quite helpful.
It's helpful. And I'm also flexible in the sense of if someone tells me, Kristen, I think this goal is more because you need a goal than because I need a goal, which someone has told me before, I was
That's
like,
awesome.
it's like, you know, you're right. I work best when I have a goal.
Hmm.
I do. And I want to have that thread in my head of like,
Yeah.
okay, what am I coming back to with you from session to session? Where am I trying to help you the most?
Right.
And if you feel like I'm pulling you this way, because in my mind, the goal is this direction, but you want to go this way, and you tell me that, it's like, great. Now I can realign and we won't have like a rupture in our relationship, right? We'll
Hmm.
actually kind of clarify our purpose, clarify our
Right.
focus. And that can be really helpful um, when people have the trust in a therapist to do that. I think a lot of the
Hmm.
reasons why people don't continue in therapy is because they want this, but the
Hmm.
therapist is giving them that,
Hmm.
and they don't have the safety to really be like, hey, I need something different.
Well, and there's that feedback, as you put it, in the sense that if for that matter, if the client, patient, however, whatever word you want to use, doesn't feel comfortable being able to call you out, they might be wrong. Who knows? But if they're not comfortable being able to say their own, honest assessment of what's going on and their understanding of what's been occurring, well, then what are you doing? I mean, like, this
Exactly.
isn't
Yes.
this
Like,
isn't
what's the
some like
point?
dictate. Yeah, we're not the authority figure, at least in a sense of a guru. This is, yeah. Come on, this is back and
Yes,
forth.
exactly.
Right.
And so then I think all the different interventions I use, like whether it's going to be EMDR, which is just a trauma therapy for people
Hmm.
who aren't familiar with it, or more like psychodynamic kind of approach of really
Hmm.
working on kind of like changing those patterns that they're stuck in, or like more skill based work like CBT or DBT skills. Our goal informs all of that. So when we're doing the goal process, I kind of explain to them there's different paths to reach this goal. Let's see, how do you learn best? Let's look at how your mind works and see what approach might work best for you. Because, for example, some people tell me, oh, I'm really good at visualizing, like guided meditations and stuff like
Hmm.
that. If it works well for them, then I know, oh, EMDR might be a little easier because it does involve a lot of visualization.
Right.
You can do it with people who don't visualize. It's just, I need to know that because then I'm
Hmm.
going to take a different approach, and I'll kind of see, oh, if you're like more somatic, if you feel it in your body, then we'll do more of like the somatic type of
Hmm.
interventions. If you're a thinker, then maybe we need to look at the emotions.
Right.
And I love emotion regulation. That's like my secret obsession is emotion regulation.
Oh, okay. We're
Yeah.
all right. We're gonna come back to that one because we can go a lot with there. That'll be fun. Okay, so we've already mentioned some of the like interventions and people like give it up to God as an example. Our connection initially started because of your association with the psychotherapy project, and for those of course interested, it's put on by Recovering from Religion, which is again not anti-religious. It is for those who are dealing with and struggling with the things that happen often, but not always, as people learn to question and come out of their certain religious backgrounds. And the Psychotherapy Project, of course, is that list of clinicians that exist who say, no, you're here for clinical care. You're not here for my proselytization. You are not going to get crystals. You're not going to get, turned to Allah or Jesus. This is evidence based clinical practices. And so, obviously, beyond my elevator pitch there, what drew you initially to the STP?
Yeah, well, I had been encountering a lot of people with religious trauma in my
Mm.
practice, and also people who wanted to, come out with their sexuality or their gender identity. But one of the stuck points was, homophobia connected with like religious teachings in
Mm.
their family of origin. And so when I found this resource, I was like, oh, I should be a part of this because people really need help finding therapists who are secular therapists. I've also seen clients come to me with previous experiences of therapists using their religion in therapy in a
Hmm.
way that was harmful for them.
Right.
Multiple. I mean, this is multiple enough that I can share generally about it without risking anyone's confidentiality. It is,
Right. Yeah.
yeah.
No, same. Definitely. Well, and it's an interesting, this can be a broader conversation a little bit, but there is that felt sense of we're we're in this profession to help. And so, of course, we're going to draw from the things that we believe do any more than the people who are going, well, this worked for me, are also then giving the kind of, you know, armchair, advice. And so it makes sense to a degree that therapists are then going to draw from their own and say, well, yes, of course, read this, scripture verse and it's going to be helpful. And yet at the same time, like you've mentioned, this is about the client, not us. And it is about how to facilitate their well-being. And that does not always include idiosyncrasies.
Yeah, well, and it's interesting because I think like religious frameworks intersect so much with belief frameworks.
Hmm.
And so in working with trauma, a big piece of it is looking at negative cognitions or, negative beliefs that people hold.
Mm-hmm.
And sometimes the religious frameworks that someone grew up in or learned have kind of like gotten intertwined with the trauma frameworks. And so it's just a big piece of the recovery involves unpacking those religious beliefs and determining,
Right.
what do they want to believe for themselves? What is adaptive for them?
Mm-hmm.
What will help them, helping them find their own meaning and purpose in life, come back to their own values. Because there's clinical benefit in working on values, meaning, and purpose. And we can do it, some people do it within a religious framework, and that's fine if they're open, I think, and direct about being like, I'm whatever religious background type of therapist. I think it's possible to do it ethically, but in my practice, it's secular.
Exactly. Right. Yes.
As much as they can be. Sometimes those religious frameworks, they pop up unexpected and you're like, oh, that's a leftover.
Like, well, yeah. Like, where did that come from? Oh, yeah. That one
Yeah.
time. Yeah. At band camp. Yes.
Yeah. Yes.
Right.
It's like the water. If you swim in the water, right? It's
Yeah.
sometimes hard to see when the water is present.
Mm-hmm.
And
Well,
then
and
you're
the
like,
brain
oh,
doesn't get
that
rid of
belief.
anything.
Yeah.
Yeah. Okay. Definitely some more.
Yes.
Come back to that. So speaking then, so you actually mentioned a really good point there around the intersection and sometimes of people's, ideological background, religious or otherwise, and where they start connecting with people's experiences, how they view them, the issues of, trauma that often come up. So how do you then view the role of religion in a person's mental health? And of course, I'm using religion very broadly here. So by all means,
Yes.
be specific or not, depending on what's helpful. Yes.
Okay, so this is the tough one. I think, well, religion there's pros and cons, just like with anything, right? And with exercise, pros and cons. I think it's more about the types of religious beliefs and how they're impacting someone, or the types of religious practices and how they're impacting someone's well-being. So, for example, if someone prays and they feel relief from their anxiety or from their depression, and they go to church and they have friends there, and then they go through life without too much shame, without too much guilt, and overall they're pretty well adjusted. I'd be like, okay, well, if you feel like this works for you, then it sounds like it's working for you. However, if you have like OCD and you have religious scrupulosity where you're praying, hundreds of times a day, and you're praying instead of connecting with your friends, you're praying instead of working, or you have so much shame that the shame is blocking you from, for example, just living like healthy adult, kinds of sexual behaviors or whatever the case may be, then it's more of a, you see what I mean? It tips in an area that I think is not helpful.
So
And that's kind of where I see the reason to really kind of look at what role is the belief playing for you, or the practices too. Those can
right.
also be harmful for people.
So there's a functional component. How is this contributing to whatever this is, a practice or a belief, and how does that belief being played out in practice? How is this contributing to perhaps, well, one, your goals and the outcomes that you're working towards, but also perhaps even some of the things that you're struggling with, for instance, self-shame about one's own sexuality, as an example.
Exactly. Yes. Yeah. And I think that's probably like my chemistry background being like, let's define the problem.
Right.
What is the problem in your eyes?
Mm-hmm.
How is it affecting your functioning? Is it impairing you in some way?
Right.
And if there's no impairment, there's no functioning issue, there's no distress around it, then, why are you in my office? You probably aren't.
Yeah, right. Yeah. Like,
You're
what are you actually hoping to get out of this? Yeah.
Yeah.
Yeah. If everything's hunky-dory.
Exactly. But what I see more often is I see people who grew up in a conservative religion.
Mm,
And then they're coming to me being like, wow, these beliefs, are feeding this a massive amount of self-criticism or shame.
mhm.
I live a double life or a triple life, right? Where I can't be honest and open with people in my life about what I'm doing because there's so much shame and the religious beliefs have just been blocking them in this way. So that's what I see most often is that. Because of course the people who are like, it's adaptive for them, they're just out living their life. I don't see them.
Right. Well, and they're not
Yeah,
going to
unless
come
I
to
see
you
them
and
through
I
something
anyway.
else. Yeah.
Yeah, they're going to go to their pastor, their priest, or imam, or whoever they're going to come to say, well, here, this is how I'm going to address these issues. So yeah, there's a kind of self-selection I think that occurs
Yes,
there. So
there
yeah,
is. And I do sometimes see religious clients who have, for other issues. And if they find like prayer is something helpful for them and it's not causing any impairment, I'll say, do what works. Like I'm
right,
never going to push someone one way or the other. It's their life.
right. Well,
Yeah.
and now we get into that kind of a thing can work even if it doesn't work the way you think it does. It's
Yes.
like prayer is a function of what you're doing, whether or not there actually ends up being a real deity or anything really doesn't matter at that level, because if this is helping you out and it's not contributing according to you then to that kind of an issue that you're then struggling with, then okay, I mean, shoot, there are any number of meditative practices out there that I would 100% advocate for that, functionally speaking, really don't look much different than some of
Yes.
people's so-called prayer practices. So, all right. Yeah.
Yeah, I agree. And I think, big piece for me of like the religious trauma is it's really just how it's showing up in someone's life. And even, for example, I work with a lot of sexual abuse survivors, and
Mm-hmm.
it's common for people to struggle with feelings of like contamination. And if someone's in a religious group that has like purification ideology, especially around sex, that can be a piece of the trauma work that we have to do is looking at that, looking at
Right.
like the purity culture or looking at how does one purify oneself or what does forgiveness look like and what does it look like for someone who's a trauma survivor but maybe like their religion has offered them one path of how to deal with this but the path for mental health recovery looks different.
Get into trauma a little bit more here in a second. So
Yeah.
then in this, and the next question then definitely kind of goes into that, which is, what role do you see then you playing as a therapist and then generally the profession in people's personal development?
Okay, so I think for the personal development side, I think it's really about kind of someone having the freedom to explore their own goals and construct their own meaning and purpose and draw from their own values. So in therapy, I do refer people often to explore their values, to explore their strengths, to try new activities that they, maybe used to be interested in, but kind of pushed to the side because, it wasn't reinforced for whatever reason. And I think, too, as a therapist, a big piece of the personal development is allowing someone to figure out the right sized thinking without me telling them what to think or what to believe. And I know this
Mm,
sounds really weird, but because I work with a lot of abuse survivors, they've been told how to think and what to believe. And a lot of
right.
the religious trauma piece also falls there of people being taught what to believe. And also things like thought crime, right? Like the thought
Mhm.
action merger, where it's like, okay, if you think something bad, that's actually harmful.
Right.
And, there's all kinds of nuance there, but often that is a big piece of people's recovery is dealing with that thought action and learning that like okay if they thought something bad about somebody did that person actually get harmed like did you actually see them get harmed from that thought no and then being able to kind of stop the cycle because usually there's a whole cycle attached to these kinds of thoughts that is really bringing someone down just helping them kind of shift out of these thought patterns that are really hurting them but I can't
Absolutely.
tell them what to think so it's like helping them me kind of
Right.
gently being like oh I see a belief here like what is the belief and a lot
Mhm.
of times people can tell me oh this belief is activated and I'll be like
Uh-huh.
okay so what happens next let's trace out the cycle
Mhm.
here of where this goes and then what if this or what if that or what would you tell a kid that had just done this thing what would you tell them so and then also psychoeducation on like what is
Right.
normal I do that is probably the closest thing I come to like telling someone what to think or believe
Right.
what is developmentally typical
here's the averages, and here's where things are healthy spectrum wise.
Mhm.
I love that. So I love these kind of chats because I mean, obviously, I have my own perspective on things, but who doesn't? But it's one of the reasons why, and I think I'm hearing you on this, where it's like how each person comes to their own sense of well-being and their capacity to make meaning and purpose and derive what, joys and passions and direction in their life is individually this, set obviously within broader sociocultural backgrounds and so on and so forth. But the same thing, like we're not aliens. We're just professionals. It's like we've just studied this probably more than is healthy. I mean, and
Yes.
and so we each are going to be coming to this as well. And the interplay that happens then in session is that building that almost a birthing place of one's own development and how they're going to move forward and address things in a new way that may not, in fact, probably won't look like how perhaps you and I might in our own lives. But if it works for them, okay, here we are. See what I can do.
That's true. Just being open to
Mm-hmm.
the process and what might happen and what the solution might look like. Because you're right. Sometimes my preconceived notion of what it might look like is not it. And that's kind of exciting, honestly, when we're
Mm-hmm.
able to just kind of like, be like, what happens if we think of it this way? What happens if we try this? And then the person's giving feedback and we're going, oh, okay. Oh yeah, no, what I need is more of this, or I'd like to go down this, you know what I mean? And then we can
Mm-hmm.
also say, well, I've noticed.
Right. When you do
I've noticed
this.
this belief. I know you say that
Mm-hmm.
this is necessary for healing,
Right.
but I'm curious, does it have to be all or nothing here?
Mm-hmm.
Like, is it really 100% of the time? Because I've observed, this exception.
Right. Right.
So it's like, it's hard. It's hard holding that tension between telling someone, I don't believe you, right? Or
Yep.
like, I don't want to reinforce that belief, and telling someone, here's my belief, just take my belief, right?
Right.
Like, I have the doctorate, here's the belief. No, like that would be, yeah, it's not helpful at all. So there's a tension there of like, hey, when do I kind of like here, let's open this up a little bit more.
But I think
Or,
you're touching then on, one of the things I bring up quite often is like religion, broadly speaking, is very, if not ever, actually the problem. It's the form it takes, the specificity with which some of the ideas and practices and how they play a role. And if you want to go broad, it's the level of authoritarianism. And we don't want to take in or take on that role. They're coming out of these situations going, I'm not allowed, the thought crime, as you put it, supposedly Jesus, if you even think about adultery, you have committed it.
yes.
I'm pretty certain a court of law would have, have an issue there. But our own lived experience knows that as well. Like I can have a lot of thoughts. I'm not going to get in trouble for them. But if I do them, that's a whole different situation. So obviously there's a moral and ethical decision making and a difference in the outcomes here. And to combine the two is, well, frankly, it's a denial of even what it is to be human. And two, it's a level of condemnation that doesn't allow you much in the way of freedom at all. Certainly not any kind of freedom to question.
Yes. And I think a big challenge is when people have been given kind of like this, like good versus evil, kind of duality, like it's right and wrong, like some prescriptive rules, those things can cause an issue later. For example, like if something bad happens to someone, but they were taught, well, good things happen to good people,
Right.
right? And now you have a trauma survivor who's like, what did I do wrong?
Right.
And that belief of like, I'm bad because something bad happened to me
Mm.
is not adaptive usually for like having good self-esteem, for being able to then, like set limits with people, or, make healthy choices in your life, feel good about you know, just feel good,
Right. Right. Well,
you know.
in allowing you the flexibility to respond to changing environments, the difficulty with that kind of black and white thinking that, often CBT in particular will address or attempt to, is that like, this isn't helpful. If the goal is biologically based in our own adaptation to shifting environments in order to pursue the events and outcomes that we want individually, collectively, and so on, that aren't entirely under our total control. And how do we get there? Well, we get there by, not thinking so narrowly that the outcome must be achieved in one way. We're there to hopefully, help them see. Yeah.
Yeah.
So that actually brings up, so you have a doctorate in depth psychology. I have to say it's been a
As
while.
in deep.
Yeah, as in deep.
Yeah, because
Uh,
people think it's hard to hear it. People think it's like death psychology and they get very
yeah,
confused.
depth, DEPTH. Yes, yes. This is like going under the surface. Of course, it's highly associated with Freud, psychodynamic, Jung, amongst others. Obviously, there are far more thinkers since then who have developed this in different ways. And so, how do you see that? I mean, because depth psychology has to do with a lot of, mythology, meaning making, how we formulate the structure of our belief practices. And so how do you see that working and informing you, particularly when you deal with people who are coming out of ideological change of whatever kind? It doesn't be religious or not, but yeah.
Yeah, well, I think it's interesting because Carl Jung, and I might not do the best job of explaining this, but Carl
You will
Jung
not be graded.
described how, in the past we had gods and religion at the center, but in this like kind of when he was looking ahead at the future, he said, the center is it's not going to have religion in the center, and like mankind has to kind of fill in the center in a way. It's like we have to figure out how we're going to like make meaning ourselves. Like there's this movement away from the way that we've lived in the past, where kind of religion was the center of everybody's life. And I think we have seen that more people are secular today, at this point in time. And so I think it's really interesting seeing how do people organize their lives and what is taking up most of the attention. And I love this. I had
Mm-hmm.
this friend who was like, whatever you think about the most, that is your God. And I was like, that is a very interesting. So, okay,
Mm-hmm.
what is capturing our attention? Is
Right.
it social media? Is it our smartphone? What are we putting in the center of our life today? And so I think, depth psychology, it's more of like a way of like inquiry,
Mm-hmm.
I guess. And just when I'm working with people from this framework, I'm just curious about, okay, what is like the center of your life? Like what is taking up all of your energy and your attention? Are you very like very thought focused where I ask you, how are you feeling? And they tell me, I think. Right? I'm like, can we use an emotion word? I think
Right.
it's hard. It's stressful.
Mm-hmm.
It's stressful. I'm like, okay, you know what I mean? I think it's interesting
Yeah.
how we kind of end up not balanced, and what does even balance mean or look like. But I think we have
Mm-hmm.
a tendency to be kind of like all one way or all the other way, just kind of we fall into extremes or polar opposites as humans, and then sometimes we bounce back and forth as we're working towards change. So I'll see someone go from one extreme to the other, and I'll just say that's a normal part of working
Mm-hmm.
towards change. Is it's kind of like the person who tries to quit drinking and then they go on a spending spree and
Right.
they spend all their money.
What are you replacing this with? Yes.
Yeah, and you're like,
Yeah.
okay, well, we're not exactly where you wanted to be,
Right. Right.
but let's see, there's movement. It's just not always a straight line. Sometimes it's more of a spiral.
Yes, both upwards and downwards. I had an art therapist a while back who described that in the kind of upward spiral of our own lives, of going when we find ourselves touching on things that we thought were dealt with, so called, which is itself an assumption around how the mind works. But part of the thing to recognize is that even though it may seem the same, we are not in the same position anymore, simply because time has passed and other experiences come up. So we might be skipping over that a little bit, but we're one layer above. So what are we going to do now with this new understanding? Or are we going to trap ourselves into thinking, here it is again, I must have never actually made any progress? Or now we start coming into certain erroneous beliefs that are, shortchanging our own, abilities to respond. And how do you then address those and go, yeah, it's all right, this only appears to be the same thing. It is in fact not, and that is a good thing.
Yes, and it's cool because something that I like a lot about depth psychology is just I guess just the acceptance for the human experience and how not judgmental it can be.
Hmm.
Like Carl Jung did art and he wrote about basically talking to himself, walking through the garden, talking to kind of like parts of his imagination, figures from his dreams, stuff like that. I mean, and he talked about different ways of integrating. Like he would build little structures, like basically like with building blocks and stuff like that.
Right.
And it's things where, if you told a CBT therapist, you go in there as an adult and you're like, hey, I was talking to myself in the garden.
You're like, yeah.
What's happening? Whereas, from depth psychotherapy, you might be like, okay, well, what was that conversation like? What
Uh-huh.
came up? What are you integrating? What are you trying to work through? What are you making meaning out of? And there is this kind of thing of like being able to hold opposites and like work with paradoxes that I like
Hmm.
too, because a lot of times in mental health, it's like, people want to come in and they just want to be like all one good thing. But it's like, can we hold both? Like, can we
Right.
hold, for example, like if you grew up and your mother was like really, really hard, can
Hmm.
you, on the one hand, be like, she did these things that, hurt me or whatever the case may be. But on the other hand, can we recognize like what she did do for you or like some of the strengths, some of the resources that you've also inherited now? You know what I mean? So having this and being able to hold these seemingly opposite things can actually be really helpful for trauma recovery because
Hmm.
often we have loyalty to people who have hurt us. And if we're just all negative, it triggers that loyalty and we
Yep.
feel like garbage. Also, a lot of times we've internalized aspects of these, people who have hurt us, or we've taken on like some of the negative voice or something like that. And if we're able to have compassion for other people and for ourselves, like research shows compassion helps. But there's no
Yes, it
shortcut
does.
there.
There
It's
is
like
not.
no shortcut.
Yeah.
But I like that
Well,
dual, you know what I mean, the dual thinking.
yeah. Well, and other worries, hearing, like I use the term tension,
Yes.
or even kind of normalizing cognitive dissonance. It often gets portrayed as this negativity thing where if you're experiencing it, it's a problem. I almost anymore these days, really want to actually take that back almost as a no, cognitive dissonance is actually a healthy response pattern or just response to the vagueness of life, the fact that we can hold these multiple things at any given time, the almost, was it the growth edge was a big phrase years ago. It's like you need to find your growth edge. And it's similar to that, where it's like here's where things churn, and what is going to come out of this process of tension and creativity, which is itself a depth perspective, and kind of going, well, what are we building out of this, and can we challenge it? Can we allow the space for it to create something new that might help us see things a little differently, and therefore allow us to respond more healthily rather than being so caged, as the case may be.
Yes.
Yeah.
Yeah, and I think it's cool because another piece, just as I'm thinking about the depth psychology stuff, is the ability to work with countertransference and transference.
Hmm.
Because I think more and more people are recognizing the importance of being able to work
Right.
on like the dynamics that occur in the therapy relationship.
Hmm.
And depth psychology spends a lot of time on like attachment theory and relationship dynamics. And so I think that's one way too that it can be really helpful. It's important to like take things personally, but also not take things personally. If someone, for example, is asking me, which happens, right? Sometimes in trauma work, the countertransference or the transference, it repeats earlier trauma dynamics. So someone might try to cross the boundary or demand something of you that would be objectively harmful. The transference lens provides a way to work through that in a way that's safe and helpful so that like therapy can continue.
Right.
Yeah.
So we're using those terms, transference, countertransference. I think many people think they've heard it from some TikTok video, which is hopefully the last time I will ever mention TikTok, at least in this conversation. And so for those who are interested in giving your background, how would you define both of those terms?
Okay. I'm trying to think of the best way to describe this. So I would say, and you're like, the unconscious does not exist.
Oh, now you're bringing up previous conversations.
I think this is how I would kind of describe it in just a
Sure.
really basic element is I would say there's things that we are aware of completely.
Hmm.
And then there are things that are outside of our direct awareness. And then there are things that are very far outside of our awareness. So there's like a gradual kind of it's on a spectrum.
Hmm.
And sometimes it's something where it's like you really don't notice it until a friend points it out to you. And you're like, we've all had those moments, I think, where you're like, whoa, I had no idea. Okay. So sometimes the transference stuff is happening in that realm of like, you're
Right.
very unlikely to notice it. But it could be something like, for example, you come to therapy and, the therapist is asking you, questions about like your negative belief. And then you tell them, I just need you to tell me what to believe. And then
Hmm.
right? I just need you to tell me what to believe. And then the therapist is like, I understand. And then they're like, don't sugarcoat it. Like, you're the
Hmm.
expert. Tell me what to believe. And then you find out this is someone who has been told their whole life what to believe. And that's why they're in your office. And so you can say something like, if you've recognized that this is a pattern that's happening over and over again, and you can say, like, I'm noticing, like, you're demanding that I tell you what to believe. But that's part of how you were hurt before. And my job as a therapist is not to tell you what to believe, it's to help you explore different ways of looking at this situation, different ways of thinking about it. And then you can see what beliefs are more adaptive for you. If I just give you the belief, then you're going to be dependent on me in the future too, to give you the belief.
Right. So in some
And
ways,
yeah, it's like I'm not meeting the need, but I'm explaining why I'm not meeting the need.
mhm.
And then I can see, how do they feel about that? And they might be angry, which is totally okay.
Yep, heard that.
Yeah, right.
Yep.
Or like
Well,
if,
that
yeah, they might be angry.
yeah.
But
Well, because in the anger makes sense given that. So in some ways, and that was thank you for that. So transference, and that's in some ways hearing it as it's the client declaring, I think you're operating, or I need you to operate within the structure of how I see the world,
Mhm.
and this is how. And if you're not fitting it, your behavior isn't matching my experience and my analysis of how things should be. Therefore, I'm going to need you to, come back and fit what I want in the way that I want it. And if you don't, well, now I'm going to be upset by it, which totally makes sense. Cause I mean, who wouldn't be upset if the world isn't operating the way they want? I mean, that usually is frustrating, anxiety inducing, and to varying degrees, trauma inducing. I mean, ultimately, it's like the world didn't work the way I expected. And to the degree at which it didn't, and it affected me negatively, now we're talking about trauma. And transference is just that whole thing right there and right in the session.
Yes, and it can happen. Transference can show up in a lot of different ways. Like a
Mm-hmm.
client might develop, feelings
Mm-hmm.
like a romantic attraction or a sexual attraction towards their therapist. They might, kind of read into certain behaviors that the therapist is doing.
Mm-hmm.
Now, a healthy therapist will just provide like the boundary and the containment, right? And
Right.
say something like, therapy does not include sex. Therapy, does not include romantic relationships. I
Mm-hmm.
understand like that these feelings have come up. Can we see where are they coming from? Can we
Mm-hmm.
safely kind of see what is this about? Is this about kind of in the past? Like you used, people have to be really careful about this. I'm thinking like
Yes.
one of the examples would be like if someone had always used sex
Mm-hmm.
to get power that
Mm-hmm.
they needed. And so then in therapy, maybe they would try to do the same thing.
Right.
And it's just literally like a human doing what they did to get the power they needed, to get the
Mm-hmm.
security they needed, or if that's how they received validation or love, maybe they want to be validated and loved the same way,
Yep.
and that's why therapists really need to have good training on
Mm-hmm.
boundary setting so that they can kind of safely help a client work through how this is coming up, why we can't meet that need, that sort of thing.
Mm-hmm.
And it can happen the opposite. So, like, therapists have their countertransference
It's
too. And
countertransference, right?
that can be a tricky one because people, like therapists can fall asleep. I'm like, they can fall asleep.
Mm-hmm.
Maybe they'll like dread a session. Maybe they'll like shut a client down. It can go on a spectrum of things that are like pretty benign to things that are more serious.
Right.
So that it can be powerful too because it's not always conscious. People aren't always aware of what's driving them or what's impacting them with the client, which is why it's good to have like a mindfulness training where you can
Hmm.
kind of recognize, oh, this feeling is, this feeling in my body is coming up, or this emotion's coming up, or why am I thinking about my grocery list? I shouldn't think about my grocery list right now. Like you need that kind of reflexive capacity so you can not just stay in the countertransference.
Right. Well, and I think this may be, you and I are using similar phrasings, and the this is where things get interesting when in how these work in practice and the layers of do you have a dialogue around the level of practicality, like how does this appear, kind of like back to that question we talked about before around prayer and so on, and then there's another layer of dialogue to say, okay, what do these what do these theories say about, point to, correspond to actual things in in experience and in reality. So that question of like a person's prayer as an action will perhaps facilitate a particular outcome that could be really helpful. That doesn't mean that you're actually talking to some kind of supernatural being. And so I find that that difference, that layered conversation is often then happening, even when talking about, various psychological theories. It's like this can appear, we mentioned purple hat before, it can appear that this structure is helping. Whether or not it actually is a different question to engage with.
Yeah, well, I think maybe if we want to look at like this, like the science basis, that I think is the most kind of, maybe it's a helpful way to kind of distill this down,
Mm-hmm.
but just the attachment theory and the research they've done on attunement
Mm-hmm.
and like the role of our mirror neurons and how
Mm-hmm.
our mirror neurons allow us to then experience to a degree what we're reading in another person. So, for example, like if I'm in session with somebody and all of a sudden I'm feeling really like tight in my throat or in
Mm-hmm.
my chest, or I'm feeling anxious, I know myself well enough to know, okay, this is a sign that I'm attuned to this client and I might be picking up something that they're experiencing. So I might then use this clinically in a way that's helpful. I might say something like, what are you noticing in your body right now?
Mm-hmm.
And if they say nothing, I might say, can you check in with your throat?
Right.
Because some of them are like, there's a degree of dissociation present. So I might
Yep.
ask, like, can you check in on your throat? And then if they're like, it's really nothing, I'm like, okay, who knows what that was. But if they're like, oh, I feel
Mm-hmm.
tightness, I'm like, okay, just notice the tightness.
Mm-hmm.
And we can just kind of that way, what was outside of the conversation but was important and needed to be addressed has now come up, and often that's enough to just help it shift. Or if I'm
Mm-hmm.
noticing some anxiety, I might say, how are you feeling right now? And if they're like, oh, I am feeling, most of the time it is, oh, I am feeling a little anxious, I'm like, okay, well then let's use a skill together, because often it's like the emotions running underneath, and when we take the second to pause the conversation and check in on the emotion present, that is super helpful.
Right. Well, and it seems like, there's a recognition seemingly then of the continuity of the human experience. No matter the differences obviously that exist in the past, how we respond to things is at least enough of an overlap. I like to describe dialogue as a Venn diagram that never becomes a perfect circle. In the rub that we do, the difficulty that comes up is that constant error correction of, for instance, great examples around like feeling a tension. Now, that's my interpretation. I can't see in your head. We're not floating heads, kind of in some mystical experience. It's like there's part of me that has interpreted this based on my own experience in this way. I could be completely, like, it could be just me. Like, who knows? It could be false. Any more than any number of things. We see a turkey in the sky. It's just a cloud formation. Like we've imposed
Yes.
that, imagery onto it. And the same thing then is happening, well, broadly, but also here in the therapeutic session where it's like, I'm feeling this. How does that? And then like you say, like that might give the person a permission to go, yeah, actually, I'm here. Now, whether or not, we don't have to get into the weeds here, but it's like whether or not part of it's languaging, and I tend to sometimes get a little pedantic. I will fully recognize that. So, there's that question of like, did a mind meet another mind, or is it the commonality then of our human experience that we're then sharing with the other person? Here's where I'm at. And then
Yeah.
they come back and go, yeah, or No, I think you're full of it. You totally missed the mark on that one. You're like, oh, maybe I did. Okay. But even
Well,
that,
sometimes we do. Yeah,
right.
sometimes we do.
Oh my
Sometimes it's a
gosh. Yes,
miss, which is
it is.
okay. And from an
Right.
attachment perspective, like sometimes we are attuned and
Hmm.
sometimes there are these like moments of like rupture or just misattunement.
Yeah.
But the research on co-regulation is really interesting. And
Hmm.
I love seeing these things of like the brain scans of like a mom and a baby.
Hmm.
And you can see the same areas of the brain are lit up and
Hmm.
they're just embracing, like the power of that kind of just human to human coexistence. And even when we're sitting in, the space with our clients, like we're breathing, we're helping them, right? And like when we help them communicate, help
Right.
them, find the words for their emotions, help them talk through something, usually I think like the emotion level changes in the room. Like, haven't you
Hmm.
had the felt experience of like throughout a session,
Oh yeah.
someone might go like up here and then, at the end of session, hopefully they're a little calmer or, in a
Hopefully. Yeah.
hopefully. Doesn't always end that way.
It does not.
Sometimes we
It does
end
not.
session like, I feel awful. Let's go for a walk. That was
Yep.
hard.
Oh yeah. Well, and
Yeah.
that's, there's this theory of, the extended mind, as the notion that how we think about ourselves, and I do mean selves plural, but it gets extended as well through the technological and broadly speaking technology. So everything from, our clothes of what we're wearing to literally our phones and so on. Like, we are extending how we interact with the world as we are in it. And people are part of that. We don't, and hence that kind of constant back and forth of, I'm thinking, but I could be wrong. And I'm going to engage in dialogue from a position, hopefully, of humility, because I'm going to be essentially error correcting either through confirmation or through, well, I'm going to have to ask some more questions, or, I read this wrong, or, whatever it may be. And that give and take, I think, in some ways, where depth psychology plays such a great role of highlighting, is that back and forth. Like, we are co-creating this experience to some degree. Like, the notion of this, we're not billiard balls bouncing off of each other. We are, compounds. It's like that have built this experience. To come back to your chemistry background, it's like,
Yes.
in what are we, what is the nature of what we've built, even in this moment, within this context, and what can we build from that?
Yes. And it's
Yeah.
amazing how one-sided
Hmm.
clinical stuff tends to be. Like if you write a note of a therapy session and it's all client focused,
Right.
you know what I mean? It's
Yep.
sometimes very important, stuff gets left out. And
Hmm.
I've been surprised at how, because like I have very old visible self-harm scars and they're visible. I mean, to me,
Hmm.
this is like someone showing up in my office in a wheelchair. No one would be like, oh, why are you choosing to show your wheelchair? It's like, no, they're in the wheelchair. They need it to move,
Right.
right? It's like, it's just my body. And
Hmm.
I get hot. I'm not going to walk around covered from head to
Hmm.
toe. It's just my personal choice. But it's amazing how people have responded. They're
Right.
like, oh, wow, that's like that self-disclosure, like that's brave. And I'm like, no, this is literally just me showing
Just
up in my
me.
body.
Right. Yeah.
I've worked through my own, you know what I mean? It's like,
Hmm.
I think it's important to see like, no, this is a part of who I am as a therapist. It's my own like lived experience. And I don't talk at length about it, but I do acknowledge it because it's like, it would be ridiculous to me not to. Like if a
Yeah.
therapist is sitting in front of you and they visibly have something that maybe you don't see every day, it could be
Uh-huh.
nice to just note it. Be like, oh, yes, that's a part of my story. How is that for you? And then someone can say how it is for them,
Right.
and that's
Absolutely.
a part of me as a therapist. But can you imagine, like, it would be so different to just leave that out entirely?
It's the old
Yeah.
caricature of the therapist as a blank slate.
Yeah.
It's the old, you sit on the couch as the client, and yes, explain further. And you
Mhm.
give nothing, which of course, it reminds me of all, the smart aleck teenagers. I'm not going to do anything. Well,
Yeah.
that actually is something. You can't do nothing. Even when you're dead, your body's doing something. It's just decomposing.
Mhm.
It's like, we
Yes.
can't, we're biological creatures. We must act. It's whether or not we are engaging in that activity with a degree of humble awareness to go, here's one way of looking at this. There are probably at least a half dozen others, and I'm going to figure that out together because literally everybody else is intersecting here. We don't get to choose whether or not we're being affected by things. Insofar as we have a choice at all, it's going to be what are we going to do with what shows up, in our sphere of responsibility. So,
Yes, and
yeah.
we do. And I think we have to be vulnerable as therapists. We have to be
Mhm.
boundaried, but I do think we have to be vulnerable because, like
Mhm.
with EMDR, I was recently practicing this positive affect tolerance protocol
Mhm.
that they have, which is around helping people tolerate positive emotions. And it
Mhm.
involves therapist client practice
Right.
of giving compliments and receiving compliments.
Okay.
And in the moment, I realized, wow, this is very uncomfortable. And I was like, you know what? Being able to be human in that moment and being able to be like, this is uncomfortable. I did not anticipate, right? And
Right.
it provided an honesty and and just, and to me, that is self-disclosure is something, I document briefly, just even saying
Mhm.
like if you're whatever you're noticing. But I
Yeah.
was like, I can see why some people are a blank wall, but it wouldn't work for the way I work. I just have to be, you know what I mean? I have to be
Yeah.
myself.
Well, and
So I
that's,
can
I
focus
mean,
on them, It's like,
yeah, absolutely. Well, and that's, I mean, in the criticism there for me is that you can't be. Like, you can say all day long that you're a blank wall, but
you
it's
can't
just
be.
not. It's just
Yeah.
not how that works. Like, like, it's a nice belief that, but it's not actually pertaining to anything. That says as much about how you want things to be than it does about how things actually are. And if you're not aware, how much is going on, that because of a dedication to talking about religious trauma and coming out of authoritarian, perspectives, like how much does the dedication to viewing a world and ourselves from a very myopic perspective hide us from the things that are happening regardless? Like, it doesn't matter if you deny it or not, it's happening. And how much surprise and uncertainty and leading to varying emotional difficulties that are going to be developed because we weren't allowed the space to see the things that are happening. And how awful.
Yeah. And it's a detriment, I think, to the practice of therapy.
Mm-hmm.
That stuff gets left out, like the practical implications of being a
Right.
therapist, of showing up, in a certain body or with a certain history.
Mm-hmm.
I think therapists are taught just be a blank wall because it's easier than teaching them how to be themselves in a boundaried way.
Right.
You know what I mean?
Yep. Yeah.
So I feel like we miss out on this opportunity to actually, you know what I mean, teach people
Mm-hmm.
how to self-disclose in an ethical way,
Right.
in
Right.
a skillful way that will be conducive to someone's goals,
Mm-hmm.
so that they're not just like vomiting in a therapy room
Right.
because
Well,
they
you and
weren't
I were
prepared.
right. Well, and that brings up, it's like you and I were talking about before we started, our experiences in, case management and, working with people medically and so on, and figuring out, like, once you get out, if you don't start your mental health practice from the admittedly quiet calmness of a nice little office on Fifth Avenue, like, and, a lot of people there are doing good work. It's not fully to be dismissive. I totally know I'm coming across as judgmental here. And there is a little bit of that because, just to be perfectly honest, because there is that level of, it's messy. The human experience is gross. And I don't mean it in a negative way. It's just like sometimes we need a towel to clean stuff up. And it's okay to be able to give that towel to somebody and be able to go, hey, let's figure this out. And I've been there too in my own way. And I don't have to take over this session. This is about you, but know that I get it to the degree that I can. I get it. And what are we going to do together?
That's so key because there's a stigma, I think, around therapists being, authentic or,
Mm-hmm.
letting parts of their identity show. And I do think that it keeps people from talking about times that went well and times that went badly. You know what
Right.
I mean?
Yep.
Or like just
Yep.
the humanity, or like when you try to normalize, but it was not the right thing to do for somebody because this person needed their suffering to be very special. You know what I
Right.
mean?
Yep.
And there's a time and right. There's some people where that works well. The
Mm-hmm.
normalizing is so helpful, and other people where it's like, no, they really need their suffering to be unique,
Right.
and it is the wrong intervention. But if we're able to just talk openly about the reality, I think.
Mm-hmm.
of, being therapists, of doing the best we can. It allows people to learn from that. Just think about how much
Absolutely.
has been left out because someone was too afraid to say, I have self-harm scars, and a client asked me about them and I wasn't
Mm-hmm.
prepared for that. And so this is what
Right.
I said. Like
Yep.
there's people who are not going to put that in a book, but
Mm-hmm.
that would be really great to read
Yeah.
and learn from. And it helps us be better therapists when we have some kind of preparation, I feel like,
Mm-hmm.
versus learning on the fly.
Definitely. Well, and that's quite the segue. Speaking of a book and writing it and putting yourself out there, you're a therapist and highly, educated with a lot of background. And we could talk about all of this stuff for so long, and doing so again would be great. But you're more than that. You're also a poet. You write. And so what's going on there? What's your process, and where are you at with that?
Thank you. Thanks for asking about my writing.
Yeah.
I love writing. As you can tell, this is one of the ways I get meaning and purpose.
Uh-huh.
And it serves as one of those like spiritual experiences for me, writing. And so I've written poetry since I was a kid and other kind of short pieces, short stories, stuff
Mhm.
like that. I love to read. And I created a collection of poetry that is inspired by my own recovery from
Mhm.
sexual trauma when I was a teenager. And so the poems, one of them was one that I wrote when I was 17 years old. And then they
Mhm.
come all the way to present day in my life. And it's a short collection, but it kind of looks at the alchemical process of recovery. So
Mhm.
it's recursive, right? It's the
Right.
spiral. I don't hold back any punches, and I kind of cover everything from like it's like the dark and the light. So it's like the hard stuff because I don't think it's good to gloss over the hard stuff, but it's also the
Mhm.
beautiful parts of recovery, like having a family or like experiencing love or those sorts of things. So I kind of try to hold both in
Right.
this one little collection.
Beautiful. So where are you at? So it's a collection. So I take it you have a that collection coming out at some point?
Yes,
Okay.
I will be publishing it, and my goal is the early fall.
Okay.
I'm in the final stages of editing right now. I'm working with a cover designer, and I'm really excited about it.
Okay. Putting
Mhm.
yourself out there.
Yes.
Okay. Feel my own tension point
I
there.
know, it's done.
What that looks like. Yeah.
Well, it's fun because some of the poems in there I've published before, but most of them are poems that have never been, seen by the world, which
Mm.
is exciting. And it's fun to choose yourself versus to seek to be chosen. I got to this point with trying to get this small collection published where I was like, why am I trying to get someone else to publish poetry? Nobody buys
Mhm.
poetry.
Right.
And if they do, a
Yeah.
publisher won't help me sell it. I'm going to do all the work
Hmm.
myself anyways. So I should choose
Yeah.
myself and do the hard work and see what I learned from the process.
Why are you looking for permission? I
Right.
mean, shoot, it's your story. Yeah, here we are.
Yeah.
My gosh. Okay. Very cool. So do you have a title for the
Yes,
collection yet?
I
Okay.
do.
Do you mind
It
sharing?
is too jagged to hold.
Jagged Hole. Okay.
Yes. Kind of like how trauma can be, right? Hard to hold. And also how it can be hard to be held.
Mm-hmm.
Yeah, what do we hold on to? And a lot of my poems kind of play with those themes of like, what do we hold on to? What feels too sharp to hold for a long time? You have to kind of
Yeah.
like set it down, pick it up.
Okay. I'm gonna have to have you back and talk more when that comes out because that that sounds amazing.
Thank you.
I will be picking that up. So
Thank you,
many,
David. I
yeah,
appreciate
in,
it.
internal reactions to that description. That's amazing. Thank you.
Thank you. It's
Yeah.
really fun. And I feel like my writing life is a nice compliment to my work life because when
Hmm.
you work a lot with trauma, I feel like a way to translate it, transmute it. Got to do
Hmm.
something with all that. You can't just carry it around. And creative
Right.
expression is my way of, I guess, just enjoying life.
Absolutely. Yeah. Yeah. Well, you mentioned that kind of the alchemical, and as bachelor's in chemistry, which itself kind of came out of let's systematize alchemy and get
Yes.
away from the silliness to how does this actually work? There's still that element of creativity to the whole thing that hasn't been lost and shouldn't be. And using that as a metaphor here is, yeah, we're just trying to figure stuff out, putting two and two
Thank
together,
you.
and sometimes creating five. So yeah, what are we gonna do?
Yeah, I'm so glad I got to
Yeah.
nerd out with you today on this. It's so
Absolutely.
fun.
Ah, okay. Then yes, thank you very much, and we'll talk again when that comes out, and it'll be great. And yeah, so again, thank you for coming in, and we'll keep in touch.
Thank you so much for having me.
Thank you.